Good morning, and thank you for having me. My name is Amy Bertrand. I'm a patient navigator with the American Cancer Society, and I was really excited to speak today. I think in particular, there are opportunities that I get to share what I do. A lot of times it's behind the scenes, so it's exciting to come out from behind the scenes and really share what it's like to be, as we often refer to, boots on the ground, of talking about what it's like to work with patients day in and day out and be part of their team, working alongside of their clinical team, but really working with patients to identify what is the impact that cancer is going to have on a patient and family and caregiver's life. So I really enjoy talking about what I do. I've been a social worker for 20 plus years, mostly in the medical field. And when the opportunity came along to work for the American Cancer Society in the role of a navigator, I was like, yes, I love a messy situation. I like the opportunity to really dig and try to figure out a solution as best as I can. So for me, this was an awesome opportunity to really put in place many of my skills of being a social worker, and again, looking at the practical needs of patients when they're undergoing any medical crisis, but also knowing that the world of cancer and cancer treatment is really overwhelming. And so I enter each room thinking, what if this is me? And I say that to myself almost every day. What if this was me? And what would my needs be? And that helps me to just stay grounded, to start where they're starting and not assume that even though our systems are in place, that they know what it's like day in and day out and how the system's going to work them forward. So I'll share with you a bit about the program through the American Cancer Society, just to give you an idea of the overview as well as the audience in which I'm hoping to capture. Sorry, we need a... Perfect. Thank you. So the American Cancer Society Patient Navigator Program, it reaches out to those in most need, including medically underserved. Patient navigators are connected to newly diagnosed patients, families, and caregivers. We are available to be able to provide up-to-date information based on a patient's specific disease and to help connect them with resources, whether it's through the society, through their local or community support services. Currently, there are over 100 ACS navigators within the healthcare systems nationwide. In general, the role as a navigator is to try to provide up-to-date information I have available and will enter a room when meeting patient and family for the first time with an overview. If it's breast cancer, if it's lung cancer, it's a packet that gives them, again, readable information that a layperson is going to understand, that's not so riddled with medical jargon that they do not understand what we're talking about. It has visual, as well as it talks about the different types of treatment that is specific to their type of cancer or disease. The other piece is to identify who's in the room with the patient and make sure that the services that I'm delivering is also taken into account who is the care attendant and who are the caregivers, and making sure that resources and information is provided to them as a caregiver, not necessarily as the patient. Practical assistance in looking at preferred language, as we've heard across the board, making sure that literacy is identified. Can they understand the information that we're giving to them? Do they have means to be able to access information at home? We've heard some this morning about digital as well as other means of getting information out there. I work with a population in a very rural area where many homes do not have computers. They don't have access to internet, or they've chosen not to. So still being handed information that's paper form is really empowering to the patient, so that they are leaving with some information that they can either read or they can pass it off to a family member who is going to ask them many questions when they get home. And it gives them a tool that they can pass on, or if they do have access to internet, they can talk about going to the American Cancer Society site and, again, trying to find more information. The American Cancer Society has really done a lot of work with trying to identify, again, more practical needs that we can put in place and tangible for a lot of our patients and families. Transportation being one of the bigger barriers for patients to get back and forth to treatment. Access to having a car, having public transportation or not, depending on the area in which you're working, and lodging. Many of our patients are traveling great distance for either their treatment or second opinions, and through the American Cancer Society, we've come up with some wonderful resources and tools. The American Cancer Society has come up with Hope Lodge, lodges which are built across the country next to some of the largest cancer centers, or again, the geographic locations to be able to provide free lodging for patients and family members while they're undergoing treatment. Transportation is also identified with providing a Road to Recovery program, which is volunteers in a lot of communities to, again, help patients and families get to the treatment that they need to. The program delivery is in particular, the navigators are placed typically in large cancer centers that are COC certified, as well as areas that have, as I mentioned, large geographic populations or disparities in care. Trained navigators work alongside of their healthcare team with the ideal setting to be able to work with patients at time of diagnosis. Many of us have goals that are set to be able to try to meet as many patients per year at the time of diagnosis. And we work side by side with the healthcare team and with the avenue of trying to get in the door as quickly as possible to identify our role, as well as to try to assess and tease out what the areas might be for support of the patient and the family. The structure of the program where I currently work is in Vermont. I work at the University of Vermont Medical Center. We have an outpatient department that is located right in the cancer center, which is convenient. If my patients happen to be inpatient, I can visit them as well. But the current program that I have is to be able to work with the patients, often coming through what we have, which is multidisciplinary clinics. Often the patients are meeting with at least 3 physicians during these clinics, and I am the only non-physician that they are seeing on that day. My visits are usually all of maybe 10 to 15 minutes, working in and around the physicians, but it's an opportunity to share with them face-to-face that there is somebody that is here and can help them navigate the different support services that they inevitably will need. And often I'm meeting with patients who are traveling quite a distance. So I'm assessing right off, where are you coming from? Can you get here? Do you have insurance? Who's your support system? And often with the families, it's identifying, what is the age of this family? Will they be able to take time off from work? Will they need, somebody to be with them if they're arriving alone on their first day of receiving diagnosis? It is clear to me that they're going to need a lot of support moving forward. Highlights and challenges. It's been really interesting to listen this morning with the earlier panel. I can assure you there's never a dull day with delivering services. Again, lodging, transportation, getting wigs, supporting patients to make sure that they understand who their team is initially, and helping them to identify, who do I ask, where do my medical questions go, but where are the practical needs going to be addressed. And meeting somebody face-to-face like a navigator, it's just so incredible to see their face when you start to deliver, this is what I can do for you. This is how you would reach me. And all in about 10 to 15 minutes, it's impressive to see patients, their light bulbs start to go off. It doesn't take long for me to just quickly go down through and say, these are the different things that I'm looking at. My lens is very different for your care, and I want to help to meet you where you're at and give you access. There's been a lot of discussion this morning as to how do we and who do we navigate. And of course, every patient needs navigation. And I think it's ideal to just make sure that you are working at trying to navigate, even if you can't put somebody face to face. There are many different tools to do so. Making sure that there's information out there that are handouts. We have in our program many opportunities that patients from the very beginning can see and have access to Reach Me and the other navigators. And that tool is something that follows them right straight through. So if somebody does not necessarily need me right off, I know that they're going to likely pop up because I planted a seed. I've had either an opportunity to meet them or they have information, again, along their journey to be able to have access to a navigator. I believe my time's up, and I thank you all for your time.